one nation, under God, indivisible, with liberty and justice for all.
Ms. Henry, would you please do our mission, vision, and purpose, please?
Mission of Jefferson County Health Department is to promote positive health outcomes through the delivery of foundational public health services. Our vision is a healthy Jefferson County, and the purpose of the health center, the JCHD is established, maintained, and operated for the improvement of the health of all inhabitants of Jefferson County.
Thank you. Next on the agenda is approval of the agenda. Do I have a motion?
I'll make the motion.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. We have no guests at this time in the audience. Next on the agenda is approval of the minutes and expenditures. First on there is approval of the September 16, 2025 tax rate meeting minutes. We are going to have to table that because at this point in time, we do not have a quorum that was here during that meeting. Next on the agenda is approval of the October 2025 expenditures, for $37,078.85. Do I have a motion?
I think I need to correct that. Isn't it $35,078.85?
Did I give it? Oh, now we gotta.
I'm getting there.
I need new glasses. $35,078. Thank you.
Yes,
And 85 cents.
yes.
And 85 cents.
And I make the motion to accept, to approve.
I'll second that.
So we have a first and second. Is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Now you're gonna make me check all my numbers. Approval of the October 2025 electronic payments. Let me go back here to make sure I read the number correctly, unless somebody wants to do it for me. It's $506,471.76.
I make a motion to approve.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is the approval of the December electronic payments for pre-approval of the December electronic payments for $628,945.00.
I move to approve that estimated amount.
I will second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Mr. Sykes, Director's Report.
Okay, start out with, on our investment policy, the bank asked us to renew that policy, and it has to be done every 3 years. That's in our operations manual, so we don't have to have board approval, but if you would like to see that investment policy, we have copies here for you. Christy did look at it for us as well. One thing that we did in October is we were contacted by the Missouri Public Health Institute about a meeting with our local legislators. We went up to St. Louis County Health Department. The Department of Health and Senior Services, Sarah Wilson was there, Director of St. Louis County Health, St. Louis City Health Commissioner, several representatives. Most of them were from the St. Louis area. We had one of our representatives, David Castile, was there, but it was more of a meet and greet, something I need to work more on. I haven't done a lot of that, so that was a good introduction into the meeting with our legislators. We gave out some handouts. We each had time to speak on our health department and some of the activities that we do. I think we were well received. There was some good discussion. I expect that we may have some more meetings like this. It also prompted the Institute to ask us to speak at a conference next week, a governmental summit that they're having for the state that they liked some of the things that we're doing here and asked if we would do a short little talk about our health department. So I think it went well for us.
Steve, was that a district meeting? Or
District,
district meeting?
well, we had our District 97 representative there, but no, it was just, the Institute asked us to meet with with St. Louis County and St. Louis City. I think they asked for St. Charles, but they didn't go.
Okay.
And they did this around different areas, if that's what you mean, different parts of the state, where they had meetings.
I just wondered who was invited to this, so.
There was only a few invited from our county. I asked them to invite more because originally it was all St. Louis County and City, and I was like, well, if I am going, could you invite our representatives as well? So it was kind of a last minute thing. That's why we didn't have a lot of our representatives. But there was only like three or four, I think, actually, that attended. Although I think that's probably pretty good. It was put together fairly quickly, so. One thing to report is that all of our administrative staff, I think we had one supervisor that has attended, but all of our managers and administrative have attended a leadership challenge workshop. Department of Health and Senior Services sponsored this training. You had a self-evaluation. You also had evaluations from your coworkers. I think I sent one to our chairman to evaluate me. But it was an inventory of 30 specific leadership behaviors, and we went through the 2-day course, and we looked at our self-reviews and the reviews from our peers. They just kind of had an overall view of how those reports look and then how to be a better leader. My plan is hopefully they're going to continue this training. I'm going to try to get all of our supervisors through this as well. I think it was well received by our group. Finally, I just want to say thank you to all of our staff. We participated in a food drive competition within our health department, and we divided into, I believe, 4 teams, wasn't it? 4 teams. We collected over 536 food items that were given to local food pantries. So I think that's I just like to acknowledge our staff for participating in that food drive. And that's my report. Any questions?
Does anybody have any questions on what's in the rest of the packet, any of the program reports? That's the second part of the public health report under Steve. All right. Not hearing any, there are no public comments, or there's no public here to make a public comment. Next on the agenda is old business. There is no old business at this time. We're into new business, and the first on that is approval of the JCHD. It says bidding policy, but it should actually say purchasing policy. Do I have a motion to approve this so we can,
I make a motion to approve.
we have a second?
Could I have a
And then
question?
we'll have a discussion.
Second.
So we have first and second. We have discussions on the matter. Steve, do you want to go over it first? And maybe you can,
So you're going to have 2 versions. The last one I gave you just has a correction on item number 3. We talked to Christy about this morning, just a clarification on how that works. We're trying to get, we've been talking about this for quite a while, how we're trying to get our purchasing policy and how we do bidding. We're really focused on our bidding process. We have a lot of big projects that we need to go out for bid, and we wanted to streamline this, so Mr. Crawford worked on that. But it's all under our purchasing policy. So when we submitted it for legal review, Christie had some corrections regarding how state statute is set up, and that is why we have some changes in the amounts. And I think that was something you questioned.
yeah, Chrissy, maybe you can help me decipher this. I presume that this is specific to the health department because the county, our numbers are much higher than what you have here.
Yeah, it's specific to the health department. And actually, I previously made recommendations on this. I just didn't know whether or not they were adopted through the operations manual. I think that was like 2 years ago that we had revisited this. And we looked at different standards for like DHSS to try to keep in line with what the state uses. But I didn't know whether or not, I made those recommendations that the operations manual be amended at that point. I don't know if it ever was. And so these changes are actually the same ones that I had recommended 2 years ago, with the exception of under item number 3, if it's already gone through a state vetting process, then we don't have to advertise in the paper.
All right.
So if I understand correctly, the amounts that you put in here are in state statute, that we can't change those amounts in, correct? Christie?
They're not in the statute specific to the health department. I looked at the state health department, this DHSS's standards for what their purchasing levels were. And I also looked back at my notes that I had from 2 years ago whenever we made those recommendations to amend that in the operations manual. If you guys wanted to have them at a different level, you can. I didn't know whether or not, I don't know what the county utilizes, Tim. We can certainly adopt the same levels that the county uses. I think that the intention 2 years ago was to give some flexibility for some of the smaller priced items.
Yeah, I know you'll spend, we were spending a lot of time on getting, bids for these lower amounts, and you almost can't do anything.
Correct.
$15,000, I think is what we're at now, and it actually should be higher at the county, but, we just try to get little increment bump ups as we go, because like I said, $15,000, you're gonna spend a lot of time running bids, because you just will.
And I think years ago when we looked at it, Tim, I think it was as low as 5,000. And so, the director was coming to the board with every little purchase. And so the intention was to give some flexibility, beyond $5,000.
Steve,
Otherwise, you
Really, only
end
up
up
to
having to wait
12
for
we have to
more.
get a bid for,
Okay.
right?
All right.
But we could move that maybe up to 15?
Steve, did you reviewed the counties, were the numbers that you
It's
pulled?
15 and 6.
Oh, was it? Is
It's
it?
15 and 6.
Okay.
But they still require you, even under $6,000, they still require you to go get at least one other quote. You always want to check somebody, no matter what. And under $15,000, they want you to get 3 quotes, if you can. Sometimes people don't quote, and we just move on. But anything above 15 is a actual bid process. At this time, I think they're looking to potentially actually move that up later. So anyway, Dennis, you had a question?
It was about whether these were in state statute or not, so Christie answered that.
Originally, we had 5,000 not to exceed 25,000. Because I believe that's in our bylaws, isn't it? That's what it's copied off. Yeah. So we would, if we changed, we'd have to go and change our bylaws, I guess, as well.
No, that's a whole nother cat.
So,
So this matches the bylaws? No, so
This
either way, we're
version.
changing.
yeah, this version, if we keep the numbers, 5,000 not to exceed 12,000, that's not what our bylaw says. And correct me if I'm wrong. 5,000 to 25,000 is our bylaws. Can you look that up real quick?
Well, would it be a problem to just move it from 5 to 15,000? It's not asking for bids, it's asking for 3 quotes, up to 15,000. And then we could do exceed 15,000 for the bids.
I would be okay with that. I think that would give a little more flexibility, because again, it's just a pain. And I think getting quotes, make sure you keep the quotes on file, obviously,
Yeah, we
is the
do.
proper thing to do.
Amber, okay, let me make sure I heard that right. So it's not anything above 15,000 you want to go out for bid. if it's between 5,000 and 15,000, you want to require at least 3 quotes.
No. I'm just saying, change the 12,000 to 15 and keep everything else the same.
Okay.
Because the 5 to 15, it just says 3 quotes. And then over 15 are actual bids, correct?
Yeah, should be.
So, yeah, I say just leave it all the same, but just up it to 15 instead of 12 on number 2 and number 3.
And down
Okay.
emergency purchases.
And then down under emergency
I
purchase.
guess everything was 12,000 is 15 now.
Yeah,
You make that as an amendment to it?
Yeah, we'll have to change that. So we're changing 2 and the amounts on number 2 and number 3?
yeah, just everything that's 12,000 in the document will now be 15,000. So that would also fall under the emergency purchase, number 2. It would be under the competitive bidding process, would be 15.
So we're going to make that as an amendment, correct?
You can note that in the minutes for today and actually vote on it as amended.
Okay. Anybody have any other questions?
So we have to integrate this into the operations manual and the bylaws?
Yeah, because the bylaws are specific to 25,000. That's when you go out for advertised bids. So we'll have to, anything that's over 15,000 now, we'll have to go out and advertise in the newspaper, which that's not cheap, but
Do we need to put some language in here that this supersedes the bylaws?
The operations manual is meant to implement the bylaws. It's done at an administrative level. So
Okay.
if we're changing this and we want to go out for bid at 15,000, then we need to amend our bylaws to allow the admin to have the authority to have this operations manual.
Okay.
So this will be in the operations manual, and then the bylaws will be amended, is that right?
Yes.
Okay.
so this vote will amend, or we have to do a
Yes.
separate vote? Okay.
No, it would be all one vote to adopt this as the operations, as the purchasing policy in the operations manual and to amend the bylaws accordingly.
Okay, so we'll have to have a new
New motion.
motion on that, yeah, so.
So we want to adopt this
Purchasing policy
Policy.
as amended, and
And also amend the
bylaws.
bylaws to comply with this policy.
I'll second that motion.
Okay, we have a first and second, so what we're doing is we're going to approve the amended purchasing policy as well as amend the bylaws to reflect the changes necessary. We have that motion, we have a first and second. Is there any other discussion on that matter? Not hearing any, roll call, please.
Mr. Pig?
Yes?
Dr. Henry?
Yes.
Mr. Deal?
Yes.
Motion carries. Next on the agenda is the approval of the Jefferson Franklin County Action Committee WIC lease. Do we have a motion, a first and second, so we can have discussion, please?
I make a motion to approve the Jefferson Franklin Community Action WIC lease.
I second that.
First and second, discussion. Mr. Sykes, do you wish to address this first?
You know, I raised some concerns at the last board meeting, well, that WIC had brought to me about their budget shortfalls. The board voted at that time to abate November's rent. They still requested that we reduce the rent for 2026. I did some research on this. I called around, talked to different people. I talked to Dennis as well. And then I talked to the state Department of Health. director of the WIC program herself to ask about this. She was kind of surprised that they had a budget shortfall. She said it could be, she'd check into it. They actually are meeting right now with them. She sent me an email. She thinks that they can cover any shortfall they have. So I feel like maybe this should not fall on us to reduce the rent. I mean, we've got expenses with this as well. I think we're on par with how we're renting to our other tenants. So unless something just falls apart at this meeting, I would just keep it. It would be my recommendation. They asked for, I have a letter from them. They requested to reduce our rent, their rent to half, to cover their shortfall. They've already done some other things to try to shore up the budget. But after talking with the state, I feel like maybe some of that's being taken care of. So that's where I'm at. You all can talk about it if you want, but.
So their rent is $5.54 a square foot. And I'm presuming this includes electric?
We pay all utilities, right? Yeah.
All the utilities?
And you
Yeah.
cover cleaning.
Yeah, I mean, they do some of their
I
cleaning, but.
think they're being undercharged. I just did the calculation.
I think it's fine to keep it where it's at. That's my opinion.
I agree. But I guess if something does come of their meeting with the state, I guess we could revisit this at some point.
When's the last time that this has been raised?
2 or 3, we went through it, yeah.
Yeah.
So we just had a 20% increase over our living. From 2020 to now, it's been roughly 20% increase. We've not had any increase. Okay. Any other questions?
Could I just mention, it doesn't directly apply to this, but a lot of the local health agencies in Missouri operate the WIC program. And I don't know if you got any history on that, Steve, or not.
For us,
I know that when I became director back in '96, this was the situation then, and I'm not sure if the health department here has ever operated WIC. But it's possible at some point we may want to look into that. It'd be a bidding process to take that over if we were interested in doing that. There'd probably pros and cons to doing that, but it appears to me that a lot of the health departments that have the program do it because it helps their budget. So again, maybe something we may want to look into sometime in the future.
And didn't you say that this lease, they're 1 day a week or 2 days a week?
2 days a week. But they have our large conference room in Arnold, in the lower level of Arnold, and I mean, we can request that they clean it, move everything over to the side if we needed to.
Yeah.
We've done that a few times, but very rarely. So, yeah.
Yeah.
Yeah, we like having them as a tenant. They're good tenants. It's nothing to do with that. It's just that trying to reduce our rent to balance the budget doesn't really help us too much. And I think that they can figure out how to cover that and still provide WIC services. They provide 2 days up there, and I believe 2 or 3 here in Hillsborough at their own location.
As far as cleaning is concerned, they take out their trash. They do make an effort to keep their streets clean. We go in once a week and do a deep cleaning, and that's it.
Okay.
But nobody else uses that space, correct?
We use it as needed,
Yeah.
it's not often.
At one time, we looked at making office space down there with WIC being part of it, split it up and they could use it. But that was during COVID, I believe, and it got kind of pushed aside. But, I mean, if this came down to they would have to close their doors up there, then I think we could talk a little bit more seriously about it, but I don't think we're to that point, so.
Is there any other questions on the floor? All right, so we have a first and second to approve the lease with the Jefferson Franklin Community Action Corporation. Roll call vote, please.
Mr. Pig?
Yes?
Dr. Henry?
Yes.
Mr. Deal?
Yes.
And it went to sleep on me. Hang on while I open the computer.
Have we had yearly leases with them? in the
Yes.
past? So it's been every year?
I think though, was it just last year when we matched them up? We had some that ended different times and we tried to get them all on the same.
Theirs was running on not a calendar year, but a fiscal year process, and we wanted it all to be consistent with other leases, so we switched it to a calendar year process.
Okay, next on the agenda is the approval of the Provident lease. I need a motion, please.
I'll make a motion to approve the Providence lease.
Second.
I have a first and second. Discussion point, Mr. Sykes.
I don't think there's any discussion on our part.
Okay. Questions on the floor?
I have no questions.
This is for the Arnold office, correct?
Correct, yeah. Yes, they have a smaller office upstairs that they use.
So there's no problem on our part or their part?
On our part, we don't have any problems. I don't know if they've mentioned anything to you, Steve, on,
They were using it 3 days a week, now they're just down to 2 days a week.
And the services they're providing are?
They're doing behavioral, like therapy type services with a master's degree therapist.
I think it's stated in the lease exactly what they do.
Do we refer people to them?
Anything that's under that is something that we can do.
Any further questions, Mr. Deal?
No?
All right. Not having any further questions, we'll pull this to a vote. Roll call, please, on the approval of the Provident lease.
Mr. Pig?
Yes.
Dr. Henry?
Yes.
Mr. Deal?
Yes.
Next on the agenda is the approval of the Walker Scottish Rights lease. Do I have a first motion?
I'll make the motion to approve the Walker Scottish Rite Clinic lease.
Do I have a second?
I'll second.
First and second, discussion points. Mr. Sykes, is there anything on your part?
Not on our part, no.
Questions on the floor?
Okay, so this is again in Arnold.
Correct.
What do these folks do?
They do speech therapy for young children under the age of 5.
I probably need to go to that. Having no questions on the floor, I'm going to call the matter to vote. This is, again, approval of the Walker Scottish Rights lease. Roll call, please.
Mr. Pig?
Yes.
Dr. Henry?
Yes.
Mr. Deal?
Yes.
Motion carries. Next on our agenda is the CDC and FDA updates. Mr. Sykes?
I'll just quickly comment, I don't know if you all have been listening to the news lately. The CDC did update their website concerning the relationship of vaccines and autism. There was a statement put on that basically it says the claim that vaccines do not cause autism is not an evidence-based claim because studies have not ruled out the possibility that infant vaccines cause autism. This is a statement that's been put on the CDC website. We are aware of this statement. Everyone has their opinions on this topic, but this has not changed anything that we're doing in regards to delivering vaccines. Policies have not changed. There's not been any change in guidance from the CDC or the state, so we're still conducting business as usual, but we are aware of this statement. The best thing that I think individuals can do if there's concerns is to talk to their physicians about that, and do research, and they can also talk to our nurses here as well. But just letting everyone know that that's on their website, but nothing has changed with how we're doing vaccinations here.
All right. Next on the agenda is entertain topics for the next agenda. Any of the trustees here have anything they want to put on the agenda?
No.
And I was going to skip closed session, but is there anything on closed session, Ms. Coleman, that you have besides approving the minutes?
No.
Okay. Does anybody wish to go into closed session, or we wish to wait till next
Just wait.
meeting? All right.
You know,
I did want to let you guys know that I'll be sending you, so keep an eye out in your spam. It'll come from Doodle, but it'll be the link to do the director's evaluation over the next couple of days, and I will tabulate the results and get them to the personnel committee prior to the next board meeting.
All
Thank
right.
you.
Thank you.
Is the plan then to vote at the December meeting?
Yes, it'll be on the December meeting for the personnel committee to present the results and recommend any salary adjustments for the upcoming year.
Okay.
All right. Looking for an adjournment, please.
Make a motion to adjourn?
I'll second.
First and second, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Thank you, folks.